Facial rejuvenation surgery refers to a broad group of surgical procedures that are undertaken to reverse the signs of aging. The most commonly referred to procedure within the facial rejuvenation umbrella is the facelift. A facelift is a surgical procedure where incision is made in front of the ear and behind the ear to access the soft tissues and fascia of the face. That procedure allows lifting of the mid-face and lower face and typically repositions the face in this vector. Oftentimes, a facelift is combined with a neck lift. Now, we get a certain degree of neck lifting from the lift back here, but oftentimes the platysmal banding and excess fat and tissue in the submental area require a small incision underneath the chin to sculpt and reposition those tissues. So what's a mini facelift? Well, a mini facelift refers to a facelift where the incision is only in front of the ear and behind the ear. In essence, a short scar facelift. The incision that extends down into the hairline is avoided. This is good for patients who don't have much skin laxity that needs to be excised. But in patients who require a lot of skin excision, the full facelift incision is definitely recommended. So what other procedures are within the facial rejuvenation umbrella? Starting at the top, we have a brow lift or brow repositioning. Now, how we go about this depends on your hairline, but for most patients that involves small incisions either at the hairline or just behind the hairline. And we lift the eyebrows or reposition them just slightly laterally and superiorly. Moving down, we have the upper eyelids. The upper eyelids often form excess skin with time, and excising that excess skin is called an upper eyelid blepharoplasty. The lower eyelids most commonly are affected by pseudoherniation of fat, which results in lower eyelid bags. The most common way to address this is through a lower eyelid blepharoplasty involving a small incision on the inside of the eyelids and repositioning that fat. Sometimes small amounts of excess skin are removed from the lower eyelid, but typically this skin is addressed with a laser. Next, we have the upper lip. It's very common for that upper lip to elongate with age, and shortening that can have a very nice effect on the overall appearance of the face. This involves a small incision underneath the nose with a lifting up of the upper lip. I hope that helps explain some of the common facial procedures of facial rejuvenation.